Hello and welcome. Today, we're diving deep into a condition affecting the urinary system, obstructive nephropathy. This is a broad term encompassing various conditions that block the flow of urine, leading to potential kidney damage. Let's explore the causes, effects, and what can be done about it. So, what causes this obstruction? The etiologies of obstructive nephropathy are diverse. Think of it as anything that can narrow or block the urinary tract. This includes kidney stones, those painful mineral deposits that can lodge in the ureters. Other culprits are tumors within the urinary tract or pressing on it from the outside, like prostate enlargement in men. Scar tissue from previous surgeries or infections can also cause strictures or narrowings in the ureters or urethra. Congenital abnormalities present from birth, like uretero-pelvic junction obstruction, are also important considerations. Lastly, things like blood clots and even some medications can contribute to obstruction, though less commonly. Now, let's understand how this obstruction harms the kidneys. When urine flow is blocked, pressure builds up behind the obstruction. This back pressure, known as hydronephrosis, causes the renal pelvis and calyces to swell. Prolonged hydronephrosis can damage the delicate kidney tissue. Initially, the kidney might compensate, but over time, persistent obstruction leads to decreased kidney function, potentially resulting in irreversible damage and eventually kidney failure. The severity of the damage depends on the degree and duration of the obstruction. Understanding the prevalence of obstructive nephropathy can be challenging, as it encompasses a variety of underlying conditions. Kidney stones are quite common, affecting millions worldwide. Benign prostatic hyperplasia, leading to obstruction, is also extremely prevalent in older men. Congenital abnormalities, while individually rare, collectively contribute a significant proportion of cases, particularly in children. The overall incidence varies depending on age, sex, and underlying health conditions. Data collection is often specific to the individual causes, rather than obstructive nephropathy as a single entity. The signs and symptoms of obstructive nephropathy can vary greatly depending on the location and severity of the blockage. Some individuals might experience flank pain, that is, pain in their side or back, which can be dull or sharp and can come and go. Changes in urination patterns are common, including decreased urine output, increased frequency or urgency, or difficulty starting or stopping urination. Blood in the urine, or hematuria, can also be a sign. In more severe cases, patients may experience no vomiting, fever, or even swelling in the legs and ankles, known as edema. It's important to remember that some people, particularly with slowly developing obstructions, might have no noticeable symptoms at all until significant kidney damage has occurred. Diagnosing obstructive nephropathy requires a comprehensive approach. A thorough medical history and physical exam are the first steps. Urinalysis can detect blood infection or other abnormalities in the urine. Imaging studies are crucial for visualizing the urinary tract and identifying the site and cause of the obstruction. Ultrasound is often the first-line imaging test as it's non-invasive and can detect hydronephrosis. CT scans or MRI scans may be necessary for more detailed imaging. A renal scan can assess kidney function. Sometimes a cystoscopy, where a small camera is inserted into the urethra, is needed to visualize the bladder and urethra directly. Obstructive nephropathy can be classified based on several factors. We can classify by location: upper urinary tract obstruction, involving the kidneys and ureters, or lower urinary tract obstruction, involving the bladder and urethra. We can also classify by severity, ranging from mild hydronephrosis with minimal kidney damage to severe hydronephrosis with significant kidney dysfunction. Another classification is based on the duration: acute obstruction, which develops rapidly, or chronic obstruction, which develops slowly over time. Finally, we can classify based on the cause, for example, obstruction due to kidney stones, tumor, or congenital abnormality. Treatment for obstructive nephropathy focuses on relieving the obstruction and preventing further kidney damage. The specific approach depends on the underlying cause and severity. For kidney stones, treatment options include pain medication, alpha blockers to help pass the stone, shock wave lithotripsy to break up the stone, or surgical removal. For obstructions caused by tumors or strictures, surgery may be necessary to remove the obstruction or bypass it. Urinary catheters can provide temporary relief of obstruction. For prostate enlargement, medications to shrink the prostate or surgery to remove part of the prostate may be recommended. Addressing underlying infections and managing pain are also important aspects of treatment. Preventing obstructive nephropathy often involves addressing the underlying risk factors. Staying well hydrated can help prevent kidney stones. Prompt treatment of urinary tract infections can prevent the formation of scar tissue. Regular checkups and screenings, especially for men at risk of prostate enlargement, can help detect and treat obstructions early. Lifestyle modifications, such as a healthy diet and regular exercise, can also contribute to overall urinary health. The prognosis for obstructive nephropathy depends on several factors, including the underlying cause, the severity and duration of the obstruction, and the overall health of the individual. Early diagnosis and treatment can often prevent permanent kidney damage. However, prolonged or severe obstruction can lead to irreversible kidney failure requiring dialysis or kidney transplantation. Recent research is focused on developing less invasive methods for treating obstructions, improving imaging techniques for early detection, and understanding the molecular mechanisms of kidney damage in obstructive nephropathy. Ongoing research is aimed at finding new ways to prevent and treat this potentially serious condition, improving patient outcomes and quality of life.